So hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be moderating today's panel. Our webinar today is on a new era in poverty policy, the social safety net in the second Trump administration. With each new presidential administration comes the possibility of changes to public assistance programs. With the start of the second Trump administration and Republican control of both the House and Senate, our panelists will discuss the policies and administrative moves that they're tracking. This will include food assistance, Medicaid, child care subsidies, and benefits provided through the tax system, like the Earned Income Tax Credit and the Child Tax Credit. We'll also ask them to discuss how changes in the federal bureaucracy could affect program administration. We have 75 minutes today, and we'll be using a roundtable format to allow our presenters to share their insights in a more conversational setting. And we are very pleased to welcome our 4 distinguished panelists. Peggy Bailey is the Executive Vice President for Policy and Program Development for the Center on Budget and Policy Priorities. Peggy, thanks so much for joining us. And Pamela Hurd is the Carol Kohn Professor of Social Policy at the Gerald R. Ford School of Public Policy at the University of Michigan and an IRP affiliate. Pam, good to have you here.
Thanks for having me.
Josh McCabe is Director of Social Policy for the Niskanen Center. Josh, thanks for being here.
Kevin.
And Angela Rachidi is a Senior Fellow and Rowe Scholar at the American Enterprise Institute and also an IRP affiliate. Angela, good to have you here too.
Great, thanks.
This webinar is supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. I want to let you all know that we have closed captions enabled, so if you would like to use those, you can toggle those on and off at the bottom of your screen. And just so you all know, we will be posting the slides, the recording of the webinar within a day or so, and you'll receive a link to those by email. And so with that, I'd like to begin with a clarification of the relationship between federal policy and state implementation of safety net programs. Especially in what ways might presidential or congressional goals and actions have the most impact and influence at the state level, at the implementation level? Peggy, can you start us off?
Absolutely. Thanks, Judith. And it's great to be here. And thanks to IRP for hosting this webinar. So it is hard to overstate the way that state policy or that federal policy and state implementation intersect with each other. Federal policy sets the rules really for how programs will get implemented, but it's the states that carry it out. And oftentimes there's a lot of flexibility in how states can choose to carry out the various safety net programs. Things can change. They can ask for flexibilities. They can, and so that interplay is particularly important. And in that, right, the funding levels also matter to states and impact their ability to implement federal programs. If obviously if funding increases, then states have more resources to be able to implement the programs. But if the federal government cuts funding, then that can have a great impact on states' ability not just to implement that program, but then how they spend resources across other programs in order to help people in whatever area it might be, whether it's healthcare, housing, or food. The other interplay is that oftentimes federal programs require match funding from states, and states and that varies across different programs, but also impacts the interplay and the way that implementation happens. And we were talking about states, but sometimes it also trickles down to the local level. Particularly counties oftentimes have an interplay with federal programs and the state, with all three working together in order to make sure that the program reaches the intended population.
Thank you, Peggy. And Josh, and then we'll go to Angela and Pam.
Yeah, so I think it's really important if you think about our biggest anti-poverty programs, such as TANF, Medicaid, unemployment insurance. They're mostly federal-state partnerships. So I think the things you really want to look at are different waivers, right? The federal government has the power to grant waivers to experiment with different programs, either in TANF and Medicaid is two big ones. And there's usually different flavors of these. So you expect a certain flavor of waivers under Democratic administrations and a different set under Republican administrations. So we're probably going to see a bit more experimentation with work requirements and flexibility for potentially TANF dollars. And I think the second thing to look at is whether we're seeing reforms through executive orders. We saw a flurry of those the last few days, or regulatory rule changes. We saw a lot of those under the Biden administration. And those tend to be a bit less durable than when you see legislative reforms. So in the past, there was some efforts to add some more guardrails to TANF on the executive side. Those sort of got undone pretty quickly. So we probably expect to see Congress jump in and hopefully make some changes there to get something that's going to be a bit more durable. Similar things with unemployment insurance and program integrity reforms and Medicaid reforms. So being on the lookout to what is done legislatively and what is done executively.
Thank you for that, Josh. And Angela, maybe you can address this. Josh talked about kind of the durability. I'm thinking more on the front end, how quickly do things like legislative actions versus maybe an executive order, how long until those kind of get put in place and the expectation is that states or other administrations will follow those?
Yeah, that's a good question and kind of helps put this all into context. And, before I get to that, I think it's also important to understand just the vast nature of the safety net and the complexity involved. And so the answer to that question specifically and to the broader question really does depend on the program. And so there is a different relationship between the federal government and states depending on the program. And there's 80 plus safety net programs, or what I would, categorize as a means tested kind of safety net program. Granted, many of those are very small. Some might even be operated by nonprofits. But even to Josh's point, if you look at the large ones, even among those, there's this different relationship. So Medicaid is much more of a kind of state-federal partnership. I would say there's, authority there. States have a lot of, input and control because of the cost sharing. Federal government obviously does as well. SNAP, there's also a role for the state government, as Peggy mentioned, in terms of administering the program, but it's almost fully federally funded. So there's just a lot more attention and discretion at the federal level. And then you have programs like TANF that kind of shift the other way, where there's a lot of flexibility at the state level. So it really does depend. And then you have a program like the Earned Income Tax Credit and the Child Tax Credit, which states are completely outside of unless they have their own version of those. And so I think that's really important to consider. And that gets to your, more narrow question, Judith, about, what's going to have the most impact. Certainly, because SNAP is 100% federally funded, at least the benefits, the federal agency can implement directives and rules that can have a big impact. You have to follow all the rules and when you can implement things, but for the most part, pretty timely effects. If you wanted to do something in TANF, very different because it's a block grant. States have the flexibility that they need there. States have an ability in Medicaid to request waivers, but again, you have a directive from the federal government, then states respond. So it's just I'm trying to kind of articulate that complexity and how that complexity makes the broader question difficult to answer, but it also explains why you likely won't see an executive action tomorrow that's going to, it's going to dramatically change how safety net programs are implemented. Those types of dramatic changes will take more time if they happen at all.
Thank you for that, Angela. Pam?
No, I just sort of back up Angela's point, which is the huge variation. I would just target especially Medicaid as being a great example of this, even within programs. So like Josh mentioned waivers. So like you have portions of Medicaid where the federal government has a bit more control over what that implementation looks like. And then you have other portions, like when states start using the waiver authorities, where like they're just like vastly different, and states have like tremendous control over what in practice, I would argue, those waiver programs actually look like on the ground during implementation.
Great, thank you all. Besides the substance of the policies we're discussing, like benefit levels or eligibility criteria, what other aspects of policies do you particularly pay attention to when you're evaluating or planning how to evaluate their expected impact? Pam, actually, I'd like to start with your work with Don Moynihan on administrative burden, and then we'll go to Angela, Peggy, and Josh.
Yeah, I pay a lot of attention to this. So ultimately, like the distinction between what's promised in terms of eligibility guidelines and benefit levels versus what people are actually able to receive, right? We know that many federal programs, including big ones like SNAP and Medicaid, have this gap between who is eligible and, frankly, who needs those benefits versus who's actually receiving them. And there are a range of explanations for that gap, but one of them, a big one, are what we call administrative burdens, which are effectively kind of onerous and difficult experiences people have when trying to navigate either eligibility onto those programs, just getting onto them, as well as being able to stay on those programs to the extent to which you need, typically on an annual or biannual basis, demonstrate that you're still eligible. And so I pay a lot of attention, to the kinds of administrative processes that affect how difficult those processes are in practice. And I'll just give you one example about the magnitude of the impact those kinds of burdens can have. One thing I think that we're almost certainly going to see is increases at the state level in the use of work requirements in the Medicaid program via Medicaid waivers. Two states have already effectively experimented with them, both Arkansas and Georgia. And I think the Trump administration has indicated, and I think Republicans in Congress have been pretty clear, they want to see kind of more of that happening. So states will have discretion to apply for those and receive those waivers. But in practice, what we've been seeing kind of on the ground with Medicaid work requirements is, by and large, we're not really seeing increases in work per se. What we're seeing instead is people losing benefits just because they can't navigate how difficult it is to demonstrate that they're either meeting the specific work requirements and or have some waiver for why they shouldn't be subject to those work requirements. So, and it's pretty extreme. In Arkansas, nearly almost everyone that ended up getting kicked off in practice probably looked like they would have met the work requirement. It was just really complicated and difficult to demonstrate it. So yeah, this kind of rubber meets the road in terms of whether or not you can navigate all of these processes to receive the benefits for which you're eligible for is a big part of implementation. And I'll just finish off by saying that varies profoundly at the state level in terms of how difficult or easy it is to navigate, including in programs like SNAP, where, as Angela was mentioning, there's sort of less discretion there across discretion or variation across states. But we actually see pretty big differences across states, and sometimes even within states across counties, in terms of how difficult or easy it is to navigate accessing STEM and staying on STEM. So I'll stop there.
Great, thank you, Pam. Angela?
Yeah, thank you. I think it's a great question. And I think we'll likely hear different things maybe from all four of us, which I'm, anxious to hear what the others have to say as well. I mean, when I'm looking at safety net policies and then potential changes to policies, I mean, there's a few things I'm interested in evaluating. One is just, are programs or policies effectively meeting their goals? Oftentimes those are goals set out by Congress or even executive agencies. So are they effective? Are they efficiently meeting their goals? And that also includes kind of integrity of programs and being good stewards of public dollars. And then I think the last thing is consideration of, the costs and the trade-offs of those policies. I think that, especially over the past 4 years, but, this has been a trend for quite a while, the focus of our safety net policies in terms of are they effective has largely been on how many dollars are going out the door and what is, the take up. Are people able to access and, are we pushing more dollars out the door? I think obviously people, monitoring if eligible people are able to access programs is hugely important, and is government providing the assistance at levels that, are meeting people's basic needs also hugely important. But I think we have paid less attention to this kind of effectiveness question and efficiency and certainly trade-offs. So when I look at the effectiveness of policies, I also want to know how is it affecting the things that we know are foundational to reducing poverty, like employment, family formation, education, ability of people to pursue education, and the incentives and disincentives that are around all of those factors. So I think, those issues are equally important. Like I said, maybe been less of a focus in recent years, but I'm hopeful that we will not only focus on just how much can the federal government spend, we can also focus on how are those dollars being spent and is it effective?
Thank you for that. Peggy, I'm wondering how difficult or easy it is to assess programs, especially if they are going through a transformation, as we may see with this new presidential administration and Congress reprioritizing, changing priorities. How hard is it to assess these programs kind of on the move? It feels like a lot of what Pam and Angela said would be a lot easier to do years down the road and look back and say, oh yeah, this worked, this not so much. How do you do it in the moment?
So that's a great question. It is very hard to do in the moment, but I'd say many of these programs though have a long enough history and have had ebbs and flows enough that we can look back over time at trends and be able to predict. So we do a lot of predictive modeling, right? We take past trends, look at what has happened in the past. Another way is, as Pam mentioned, because there's been so much state flexibility in programs at different times, being able to look at a given state and project from that state, like Arkansas with work requirements, and be able to project, okay, well, this was the impact of this policy in this state. We can project then what is likely to happen in other states should the same policy be implemented there. So that, and we then also take lessons from other programs, right? TANF is a huge one. The way that TANF changed in 1996 fundamentally disrupted the way that we deliver cash assistance to people with the lowest incomes. We can tell, it became a block granted program. The program has not increased. Funding for that program has not increased, even though need has shifted. Work requirements were instituted as a part of that program. Therefore, the reach to the people who need cash assistance has been limited, and states have enormous flexibility within TANF to where we see a lot of abuse of how TANF resources are used. And so when policies like that are proposed, we often go to TANF to say this is the cautionary tale about what can happen to a program in the name of constraining it and reducing poverty. Instead, it doesn't have the impact and the reach that we would like for it to have.
Thanks for that. Josh, as Peggy was talking about kind of looking to the past and pulling different lessons and evidence from those, I wonder how much the COVID period kind of informs and influences policy decision making now, lessons learned. I mean, it feels like for everyone in practically every aspect of life, including public policy, it was a crash course. And a lot of things were tried, a lot of things were tried quickly. And so how is that a benefit that we have now able to look back maybe 3, 4, almost 5 years ago now of the COVID period?
Yeah, so I think it's different folks are going to draw different lessons, right? So there was a lot of new programs that were tried out. And in the moment, they did what they were supposed to do, which was support folks when they couldn't go to work, they couldn't keep an earning, but their bills were still coming in. At the same time, trying to think of the sort of potential negative lessons of that, where we saw a whole lot of fraud, we saw a whole lot of program integrity issues that had always been there, but this really put them on the forefront. So there's going to be some folks who come away looking at those positive lessons, thinking about the fully refundable child tax credit, the expanded UI, but there's going to be folks who look at those same programs and say, okay, there's these issues with either work incentives that it created, or marriage penalties it created, or waste, fraud, and abuse that it created. So I think, acknowledging that it was all these things, and that there's different directions we can potentially go in, and figure out where folks might work together on the federal level, but also on the state level, thinking about some of those lessons we've seen. Some states have already run with them. So the fully refundable child tax credit went away after 1 year. It was an emergency measure. But we've seen, I think, close to a dozen states now have a fully refundable child tax credit, somewhat similar in structure to the 2021 expansion. So I think we're going to see a bit more experimentation of here's what worked during the pandemic. We may not try it on the federal level, but states are going to try out some of these things, and we're going to get lessons going forward, and hopefully long-term lessons that aren't dependent on this one weird time in American history.
Thank you all for that. I'd like to ask how much the choice of agency leadership impacts the day-to-day functioning of agencies and the experience way downstream of program clients and benefits recipients. Hearings for nominees to head several agencies that oversee safety net programs are still to come. What will you be listening for in those hearings and other communications from either the nominees or the administration? And actually, Josh, I'll turn back to you, and then we'll go to Peggy and Pam.
Yeah, so these are always interesting because I think the really good stuff is the also the really unsexy stuff, right? So we think about things that Martin O'Malley has done with SSA, with modernization, Dana Werfel did with modernization. They don't often make it into the news, but it's that good hard work that makes it better going forward. It's going to be hard to tell, I think, ahead of time where folks are going to be. If you had asked me, would Martin O'Malley be a good SSA administrator? I couldn't tell you, so I'm not quite sure about Frank Basignio. Billy Long has some past with what I think are sort of problematic tax credits. I think folks are going to be looking at the fate of a direct file, which sort of got off the ground on the executive side. It's going to survive this year, but we'll see in the future. The one I'm really not sure about, but really interested in, is the Department of Labor under Lori Chavez DeRemer. A lot of folks have talked about her position on the PRO Act, but I don't think we quite know where she is on unemployment insurance modernization, which I think is going to be really important in the next couple of years.
Yeah, so from our point of view, I think, and I served as a part of the Biden-Harris administration, so I have a little insight that it really does depend on the person themselves and what they hold tight. Because as Josh mentioned, there are a lot of unsexy things that happen through, particularly from in the regulatory space, flexibilities on how grant programs are run, for example, and things that you can prioritize that happen behind the scenes. And if a secretary or a deputy secretary has a passion for something, could happen and not get much play. But I think what we do know with the incoming administration is that the White House is going to drive a lot of the policy, especially since this is the second term, and there's been time since the first term to be able to really learn, think, and put and get priorities in place. So especially in the things that are key priorities for the White House, it is that interplay between the White House and the agency lead that is important to watch, and can really dictate what can happen. So while the confirmation hearings, provide a lot of news, I think it's weaving a story together from what the incoming administration did the first time, is saying is important to them right now, to know that the agency heads are most likely going to fall quite in line with what the priorities are of the incoming administration.
And Peggy, based on your past experience, who are the people around the secretary, the department head? It feels like, especially if they are coming into that type of position for the first time, they're going to need a lot of support to be able to fulfill their mandate. Who are the people around them that probably, like Josh said, are not getting mentioned in the news, are not kind of the headliners?
Yeah, so well, first off it will be who they decide will be their chief of staff, because that's who's running the top line pieces of the agency. The other thing that I learned that is it's also right for some of the agencies, it may take a little bit for the secretary to get into place. And so in that stead, there's either the acting secretaries that are in place right now, who are career staff, who are just in the placeholder position till the secretary comes on board, or the frontline folks. I don't think people realize how many appointees are in the federal government. And so in this first couple of days, there's an influx of hundreds of people who are now in place in agencies that are that have some authority to be able to move policy. So if you watch the White House website, they'll be announcing who the political appointees are within any agency, and so watching those folks is particularly important, because a secretary isn't going to get into the day-to-day pieces, right? They're setting an agenda, they're saying what's important to them, and they're relaying what's important to the White House. It's these other appointees that are the ones that are working with the career staff to get anything done. So oftentimes, I know I flew under the radar. People fly under the radar all the time. That actually, but those folks that are sitting in the secretary's offices that are the political appointees are definitely people to watch.
And Pam, do we have a sense of, I'm assuming there's that layer of political appointees, and then there are people who are just kind of chugging away from administration to administration, probably on the lower rungs of an org chart, but doing really important work. And it would seem to me providing a lot of consistency and kind of a through line. Do we have a sense in the last few transitions how many of those folks stay or don't?
Well, I guess I would just sort of step back and sort of say, I think the changes that are being discussed around, I think there's a lot we don't know right now, right? So there's a lot of changes around Schedule F, and will this pool of political appointees be expanded? Who is going to stay? Who's going to be asked to leave? I feel like there's a lot of, we're clearly, I think it's a kind of reasonable thing to say, like, based on some of what we know, it looks like there'd be more than maybe in the past in terms of some turnover. But what I would sort of generically say to step back and really think about with something like this is just going back to the original point about how complicated the social welfare safety net is in the US once you start looking at these specific programs. And that complexity makes them difficult to manage as well at the federal level. And so one thing I kind of think about is like the level of experience that people have coming into these positions in terms of their ability to kind of navigate that complexity, their ability to kind of understand what's going on beneath the surface, both including people who are career employees who've been there a long time. So that's I think another part of the equation that we're still not 100% clear yet, I think about, because there's a lot of people who haven't been appointed in terms of what that like level of experience is going to look like. And I think that really has just basic implications. I don't care whether you're a Democrat or a Republican, it has real implications about your ability to like get things done. And so, yeah, I think that's one thing that'll be kind of interesting to see going forward.
Talking about that size of the government and those employees, a new advisory team with the working title of the Department of Government Efficiency, or DOGE, is taking shape with Elon Musk leading that effort. And the goal, as I've seen it and understood it, is to actually put folks in a variety of federal agencies, embed them, if you will, for a couple months to see where there are places to improve efficiencies and make cuts. I'd like to hear how you see their goals affecting access to an administration of the safety net. And Angela, I'd like to start with you because you were a co-signer on a letter to DOGE, making some suggestions and highlighting, as you did earlier, the vast array of safety net programs and how they do or don't kind of fit together. And then we'll go to Pam and Josh.
Yeah, another great question. I mean, my first response is I'm not sure they have to necessarily embed anybody in any of these agencies. I guarantee people who have worked for these agencies for years have hundreds of ideas of how you can increase efficiency and streamline some of these agencies. It's just the nature of these large bureaucratic agencies that there's a lot of inefficiencies, and staff are the first ones who understand that and who have ideas. So I'm hopeful that something like DOGE will go in and talk to people who have been there for a long time and really generate ideas from them. To your point about our letter, yes, I think if you think of the safety net broadly, all the programs that exist, I think there's a lot of opportunity to increase efficiencies, reduce redundancy. There's so much duplication. There's an opportunity to look at rules and regulations across programs, align definitions of basic things like what is a child, which is different depending on the program that you're talking about. So I think that I would like to see, a focus there. I think there's been discussion about, make everybody, who's remote come into the office, and can we just cut whole departments? Like, that'll probably be part of the discussion. But I think more importantly for the safety net, it's about, where are there these duplications that are requiring resources that could be better utilized somewhere else, that can be utilized to better serve participants, to make the process easier for them. Like, you hear so much frustration from participants about the system and how hard it is to navigate. Part of that is because of all these bureaucratic rules and regulations. And so I'm hopeful that will be the focus. And that was kind of the intent of the letter that I co-authored.
Thanks, Angela. And Pam, one of the things that I'm thinking about listening to Angela and the rest of you is, I guess, where are efficiencies best found? Because it seems like, especially because so much does go to the state level, and states have very different makeups of population, of levels of poverty, of many of the different infrastructure. How effective can it be to try to duplicate the same kind of efficiencies in what might be very different landscapes?
So I just actually really want to back up Angela's point here and link it to something I was also talking about earlier, which is, sometimes I actually 100% agree. There's real inefficiencies in terms of how we administer these programs that are both make it difficult for beneficiaries to access them and also end up just costing us a lot more money too. So just to be very specific about things like, the push towards having states and the federal government rely on existing administrative data to verify eligibility rather than sending people out and compiling letters and receipts and pay stubs. And, so those kinds of trends, I think, are where we can really do both things at once. We can both increase access to these programs among the eligible while also improving efficiency, basically, like spending less money on the administration. And we have a lot of, I think, a growing pool of experience about how to do it. You are correct. It does get more complicated in terms of once you start looking at the state level, in part because some of the reasons states don't do things like this or do them well is not because they don't want to, but because they actually just lack the state capacity to do it. They literally lack the kind of IT infrastructure, for example, that they need to do it effectively. Or even honestly, sometimes you see at the state level, they contract out with vendors, but because they lack sufficient expertise around the IT, they really can't manage the contracts effectively. And so the vendors can take advantage of them. So I think there's so many places where we can kind of look to improve in that way. And I mean, this is one thing I would say about DOGE and generally people in my experience, at least from tech, and I have some experience with the civic tech sector, which are these folks who have tech backgrounds and then kind of go and look at ways to improve the delivery of government benefits and services. Those folks really don't like these inefficiencies. It's frustrating. And they're very much interested in trying to improve that. So I think that's there's real potential there. The one critical thing I do think we need to keep in mind, though, is in terms of programmatic goals, all of these programs have clear programmatic statutory goals. Medicaid statutory goal is to access to insurance. SNAP is about access to nutrition, right? So any of these changes that you make, we also have to keep in mind the key programmatic goals for these programs. Like a perfect policy, we're always making trade-offs, but it's critical to kind of keep those goals in mind as folks are making those choices.
Josh, as Pam and Angela were talking, I was thinking about something I think you said earlier about, especially during COVID, there was a lot of good work that happened, and because it had to be kind of fast and dirty, there were also some things that would better be avoided, like fraud or misspending or things like that. Looking at a couple of the questions that have popped up in the chat, where is the balance there? Because one of the things that one of our attendees said was if people didn't have to recertify for some programs, say on an annual basis, that could introduce some efficiencies. But then I could see the other side saying, yeah, but we really need to do this on an annual basis to make sure that people actually are still eligible. So I guess how do you see policymakers hopefully finding that sweet spot?
Yeah, no, it's tricky. I like to think of, program access and program integrity as two different sides of the same coin. And oftentimes we see them in tension with each other. But if you're doing it well, then I think they're working together, right? So, the thing I like to bring up is earned income tax credit. It's a successful program, but there's, I think, $21 billion in improper payments every year, which is more than we spend on TANF. So getting that improper payment rate down is really important, but we want to make sure we're doing it in a way that it's still accessible to folks, it's still easy to folks to apply for it, but also, the IRS is spending a whole lot of time and energy just auditing the heck out of folks because they have no other mechanism to sort of verify some of their whether qualifying children, qualifying earnings. So we really want to explore ways, and this is where I hope DOGE comes in handy, explore ways to help share information better so that either you don't have to apply every single year, or instead of submitting birth certificates or documents or whatever, government agencies who already have this information can start talking to each other, right? And just send it over one way or the other. So you get that verification, you get that program integrity, which we think is super crucial, without putting the onus on families when they're either filing their tax returns or when they're filing for different benefits.
And that actually brings up a perfect follow-up that I was going to ask Peggy to address. With your experience in the government, how much do those different agencies and departments and folks working in them actually talk to each other and maybe share things that work and caveats about things that don't? And like Josh said, thinking of ways to maybe make the process for those end beneficiaries that everyone is trying to support, make it so that not as much of the onus is on them if different departments can actually share information.
Yeah, well, in my experience, there was a lot of talking back and forth, mostly because we really had an emphasis on the fact that the end user was the same person, were the people, and so how could we align things? There's also because I was there during the pandemic, after the passage of around, or at least the creation of the infrastructure bill, things that were broad and big and sweeping across federal agencies, so that there needed to be some alignment on those big things. I think, on the day-to-day piece, obviously there's work that needs to be done on coordination. There's no doubt about that. And so with an emphasis from the politicals and leaders within agencies to be able to have that cross conversation is really important. When it gets hard, when folks feel like they're under attack or being threatened, and the natural inclination is to hunker down and not share information. And so it's really important to have a culture of inclusion, of us all wanting to solve for the same problem, to be able to bring people together in a way that's not threatening, so that they're encouraged to work together and not concerned about any vulnerabilities they're sharing when they decide to work together.
Great, thank you. One of the most significant changes to the U.S. safety net during the Biden administration was updating the Thrifty Food Plan and how that expanded food assistance, or SNAP. On the other hand, the Farm Bill was allowed to expire, so SNAP and other programs are kind of in a holding pattern right now. What signals are we getting from Congress and elsewhere on the future of food assistance? And Josh, I'll start with you.
Yeah, so I think this is one of those examples where we saw, an expansion of the program under executive action in the previous administration, and there's probably a good chance we're going to see an executive reversal of that. And this is where we get into that durability of those changes, if it's done legislatively versus the way it's been done. You're going to see a lot of changes back and forth there, I think.
And Peggy, what are you tracking on food assistance?
Pretty much what Josh said. I think, what I think is important, over 40 million people have access to food assistance now, for good reason. There are a lot of families who their incomes are not high enough for them to afford many of their basic needs, and food is top of that list. And so we're really concerned about efforts that actually would make it more efficient to deliver food assistance to people, changing work requirements, things like that could happen. And so what's top of mind for us is explaining how the ways that we could increase efficiency in order to increase access to food in a more efficient way, limiting getting rid of many of the barriers that families face, and the need to be able to expand access to food assistance because of what that gets you. We know that for, every dollar we spend on food assistance, we get around $60 worth of impact for kids in particular. And so that's what's top of mind for us when it comes to food assistance is explaining the difficulty, leaning into the fact that yes, times are tough for many families, and food is one of the things that we should make sure that everybody has access to.
Right. I'd also like to touch briefly on the issue of housing and housing assistance. We saw an 18% increase in homelessness in 2024, and I don't think it's anything new that housing costs in large portions of our country are much higher than a working family can afford to, especially to be close to the schools or the jobs or whatever they need. Angela and Pam, I'd like you to just kind of do the same thing for housing assistance as we just did for food. What are you keeping an eye on? Angela?
So I actually don't do very much work on housing. So I'd rather answer the SNAP question.
Okay, please.
if I can.
Absolutely.
And because I have a feeling I probably have some fairly controversial things to say, and so I'm sure the chat will blow up. But if we go back to kind of how I opened this webinar in terms of how I'm evaluating policies, I think SNAP fails in all regards. It's not effective if we assume that if we know the goals are to reduce food insecurity or reduce hunger, as well as to improve nutrition. It's not effectively improving nutrition. Is it efficient? No, it's not efficient. A lot of fraud in SNAP, a lot of improper payments. Error rate is higher than it's ever been. A lot of benefits going out to people, households that are not eligible. Administrative rule changes that have, I think, exploited loopholes that have raised benefits, increased eligibility. So all of that, I think, hurts the integrity of the program. And then finally, very little attention paid to the trade-offs in terms of the negative effects on employment through benefit cliffs, through other work disincentives. And we've seen this program, increase by 60% in inflation-adjusted dollars over the past decade plus. So I think there's rightly going to be a lot of attention on food assistance in the coming years. And I think it certainly should be a focus, and I think it will be for not only improvements and just the way the program operates, but definitely potential target for cuts.
And Pam, would you like to talk about SNAP or would you like to talk about housing?
I'll briefly respond to Angela. I mean, what I would say is I actually think we do have good evidence that SNAP has been effective, for example, around long-term improvements in health and well-being among children and adults. There's actually really good, robust social science showing it is actually fairly effective on those counts. I also think that we have some good recent evidence. There's a really nice paper that came out in the Economic Policy Journal in the last year that's probably the best empirical paper, I think, of in a while, actually evaluating, for example, expanded work requirements for the population of adults on SNAP, adults without children, that shows that it doesn't really improve labor force participation when we expand work requirements in those parts of the program. So I think maybe I just disagree with a little bit with Angela on the basic points about effectiveness around things like health and well-being and implications to a certain extent for labor force participation. But what I would say is, and the last thing I would say about this is, it is correct that the error rates in SNAP have increased in the past few years. What I would say is these are addressable things, though. So I think they're addressable without sort of dismantling the program. I think those are addressable problems. We've addressed them in the past. We can address them again. And Yeah, I guess so. I just wanted to sort of speak up and just say I'm just not sure I agree with that assessment of the SNAP program. The last quick thing I'll say about this is there is no way to deliver any kind of program without there being error rates. And what I would encourage people to do to think about this, now I don't mean like excessive error rates, right? But I mean, there's always going to be errors, like that's the nature of it. And it's funny because we think about it very differently in social welfare policy than we do in like private markets. So for example, there was like the whole big trend where, right, like Walgreens and stuff was like locking up all their shelves. And there was just this big article in the press recently where like the Walgreens CEO was like, it turns out that's not great for business, that like built into the private sector logic is there are going to be inefficiencies, right? There's trade-offs. So that's one thing I'm not saying like 30% error rates are okay. And that's not what we're seeing in SNAP, to be clear here. We've just definitely seen an increase, but not to that level. But that there is no way, like it's very, very difficult effectively anywhere to design programs or run things without there being some inefficiency. The question is like the right level of inefficiency and how to tackle that without throwing the baby out with the bathwater, basically.
Yeah.
Thank you all. And in the interest of time, we will hold off on the housing question, and I will let folks know that we are
answer. I could answer it quickly.
Ahead,
I can do the housing. I have the
All right.
homelessness. I just flipped around the wrong way. But what I would just say is it's really important in the housing space and policy to separate out single family housing and rental assistance housing. We're here to talk about poverty programs, so I'm going to focus in on the rental assistance housing. And I think, and we oftentimes there are misconceptions about what is driving homelessness. And it's just really important, the way that Judith set up this question, to understand that it's prices and the mismatch between prices and income that people have. And so how are we, and it is also important in the context of the other things we've talked about to understand that rental assistance is not an entitlement program. It only reaches 1 in 4 eligible households. And we don't have a guaranteed way to help people pay their rent when their income just simply doesn't match up with what the rent cost would be. And while we talk a lot about the supply and increasing supply, and we are in a supply deficit in many places, and we do need to increase the number of units, that only gets us so far, especially when we're talking about the lowest income folks, because rent has to be at a certain level. If we're going to engage in market and how in capitalist market-based housing, rents can only be so low because landlords, even if they weren't going to make a profit, still need to make enough money in rent to pay for operating costs and maintenance costs and all of these things. And we know that the lowest that rent costs could be is still more than a third of low-income folks' house incomes, which 30%, a household paying 30% of their income toward rent is what's considered affordable. So with that in mind, that's a big piece of the homelessness crisis, and is that we don't have an entitlement mechanism to be able to help supplement people's incomes when they're working hard. They may have multiple jobs, but they still just aren't making enough money to be able to afford rent. The other piece, though, is, as Angela's talked about, the safety net is broader than these entitlement and larger programs. There's other programs as well, especially in the health space, that need to be strengthened so that the folks who are experiencing homelessness and may have mental health need, a substance use treatment need, other needs, can get those while they're at home in a place where they're safe.
Thank you for jumping in there, Peggy. And I will just tell everyone we are actively working on putting together a webinar specifically about the rise in homelessness. We're looking at the end of February or beginning of March for that. And so everyone who registered for this webinar will get an email about that. As we're all following the news in the coming weeks and months, what would each of you suggest we pay attention to in terms of issues that are most likely to affect public assistance programs or the lives of people with limited incomes? And we'll go to Pam, then Josh, Angela, then Peggy.
I I think it's a lot of what we've discussed here already, to be honest with you. I mean, I think discussions again about work requirements, especially in Medicaid, I think that's really going to be on the table in terms of, I think, things we're going to be hearing a lot about. I guess that's the primary one. I mean, I am monitoring a little bit the stuff in the chat as well. I'm kind of curious to see what happens around the child tax credit, and whether or not that sort of is a discussion point again. That is something that I think different parties have different ideas about what that should look like exactly, but there's certainly been kind of some bipartisan discussion for sure about the child tax credit. So I'm sort of interested to see if anything comes of that. So I think those are the two things, at least for me, that kind of stand out right now, but I'm certainly sure I'm forgetting something. So I'm curious to see what others have to say.
Thanks, Pam. Josh?
Yeah, I think the Tax Cuts and Jobs Act of 2017, most of the major provisions are set to expire this year. Folks are calling it the Super Bowl of tax. It's an exciting bunch. So there's a lot of folks who want to extend that, but it's going to be really expensive to extend. So the two things that we're definitely watching are on the tax side, looking to changes to some of those family tax provisions. So in 2017, we saw the elimination of personal exemptions, and they beefed up the child tax credit and the standard deduction. There's the earned income tax credit, head of household filing status, child independent care credit. We do a whole lot of social policy through the tax code. If you think about it on some of the other sides, mortgage interest deductions, the local tax deduction, have some implications. So what actually makes it into that bill, I think is gonna have some important impact on different social policies, but also on the spending side, as Congress looks for different ways to reduce the overall net cost of the package. They're going to be looking to cut some social spending. So some of it is probably something where it's long overdue, that there's lots of efficiencies to be had by different reforms that would save money to these programs. But some of it, I think, for a lot of people here are going to be not so good. So keeping an eye on, when they say they're going to cut Medicaid or TANF or any of these programs, looking exactly what are folks looking to cut, how are they looking to cut it, and what is the impact of those different options. There's going to be a lot of variation there. So keeping an eye on the nuance, I think it's going to be really, really important in this tax fight.
Angela, I'm wondering if there is any sense of what the top priorities are, what we might see happening sooner rather than later. It feels, as is often the case with a new administration, there's a flurry of, it feels like everything right now. Do you have a sense of kind of what the rollout might look like? It would be hard, it would seem to me as an outsider, for there to be movement on all of this kind of simultaneously, but maybe that is possible.
Yeah, I mean, just to piggyback off what Josh said, I mean, the next year at least is just going to be consumed by the need to extend the TCJA. The Republicans are talking about doing 1 or 2 reconciliation bills, and that will involve discussion around safety net programs, but all of that has to fit into, and I'm not a federal person, so the Byrd rule, which I don't totally understand, but basically there has to be, some tangible budget savings. So that's going to kind of prevent, some of what we're talking about, or some reforms to safety net programs, because it has to kind of fit into that nice package. So I'm not sure we're going to see any major drastic changes, certainly not in the short term. I think as people get in place in these agencies and they start looking at things that happened over the last 4 years, and well, how can we either reverse those or use a similar tactic to do something we want to do, like those kind of things. I think that'll take a little bit more time, but I certainly do expect some of that to happen as well. And if I may, because I have been monitoring the chat a little bit, can I just clarify one thing? There's a lot of discussion about, fraud and my comment about fraud. I do think individual fraud occurs, and I think that's kind of to Pam's point, that's always going to happen. I'm actually not as concerned about individual fraud in SNAP. I'm concerned about like criminal organizations who are fraudulently accessing benefits and stealing benefits, and because we don't have the right technology in place to prevent that from happening. And certainly go talk to people at FNS who focus on this. I think it's a major concern, and these are people who are stealing taxpayer dollars to support these programs. And I think it deserves a lot more attention. That's actually where my concern is about fraud.
Thank you very much for clarifying that, because yes, I was seeing the chat popping as well. Peggy, what do you recommend for kind of keeping tabs on what's going on in the next few months or year?
Well, I think what I recommend is, taking a deep breath. Maybe taking treating cable news like cake and sweets, and only consuming it in small quantities. But I think the things to watch for, I think, are two big picture things. One, which we've talked about, but I just want to name broadly, is this conversation around debt, deficits, and what we can afford to do. And then also the who are we doing it for? You can, in watching what's been happening in the last couple of days, you can see that there are conversations around the words equal, equity, and justice. And you can even tell that folks are concerned about how to talk about equity and justice in a space when many of us are going to be working to defend programs that we care a lot about, because of the impact that they have on people's lives. And we can't and you can tell in the news already that we're not leaning in, we're not explaining the impact on people, and then talking about that from a demographic lens, whether and particularly on folks who have faced racism and discrimination in this country for a really, really long time. And that's one of the reasons why these safety net programs are so essential, is because of the ways that racism and discrimination have shown up for Black, Latinx, and other people of color in the course of our nation's history. In watching, in trying to digest the news, and hopefully for us to engage in the news, we've got to be able to bring those pieces together. Because, for example, when we talk about work requirements, all that is the paternalism of that is we say that it's a dog whistle, but it's front and center. We think that people, and since it's disproportionately people of color who need these programs, are too lazy and not going to work, and that is not the case. The folks are working; they're working really hard, and they're not getting paid enough for that labor to be able to afford to meet their basic needs. So my recommendation, and then when we talk about debts and deficits and what we can afford, and who and how we think about that, then all of a sudden we can't afford to correct for racism and discrimination. We can't afford to help the people who have the least, when we're not also willing to ask those who have benefited the most off of those things to pay into this great American experiment. So I think, yes, there's what we're going to see in the news, but watch for the absence of those things, I think, and then we have to engage in a conversation to bring those things front and center in a way that's unapologetic, because it's the truth. And if we don't, we're going to keep inefficiently trying to fill in the gaps of the safety net.
Thank you all. And I do want to make sure we have enough time for closing comments from all of you. Very briefly, I would like to ask each of you, if you have something you'd like to throw out there, is there a policy or a priority that you see has the most potential for bipartisan, cooperative, collaborative work? I think people are kind of desperate to see places where we as a nation and the government can come together and work for the good of folks. Angela, is there something that you see that if you want to say both sides of the aisle could really come together on and make some progress on?
Sure. I mean, I think we've seen this over the last few years. There is bipartisan interest in providing benefits to low-income families through the child tax credit. Originally, the child tax credit was not intended to be an anti-poverty program. It was tax relief, and only well, I mean, it became refundable in early 2000, so it's been around a long time, but it was always the earned income tax credit. So it was only recently that really the child tax credit has gotten so much attention. And I think that's because one has the word child in it, and it's geared towards families, and that definitely gains bipartisan interest. So I think I think there will be some bipartisan compromise on the child tax credit. I don't think it's going to be what we had in 2021, which was a fully refundable child tax credit, but I think we have seen interest from both sides of the aisle to maybe make that bigger. What my question is it going to be made bigger? How are we going to pay for it? But is it going to be from cuts to other parts of the safety net? So you're really just changing how benefits are administered? Or is it going to be additional benefits on top of what we already have? I think that's where some of the bipartisan compromise issues sort of fall apart a little bit.
Thank you for that. Any other panelists have other programs that you think have potential for cooperation?
I would have pointed out just two. So one, or set. It's funny because I know we're focused on poverty policy here, but like Social Security and Medicare are largest and arguably most effective anti-poverty policies. And there is quite a bit of bipartisan support for those programs, including things, and we know there are some changes that need to be made in those programs. The second area, though, broad cluster that we haven't talked about is disability related, which are intersect in many ways with poverty-based policies. And what I have seen at the state level, especially around kind of Medicaid long-term care, Medicaid waiver programs related to long-term care for both for people with disabilities across the age spectrum, is there does actually tend to be a lot of bipartisan work on trying to improve access, for example, to home and community-based supports for people with disabilities. That's largely going on at the state level, but I did just want to highlight that because that is an area where I think we do frequently see actually bipartisan support. And sometimes I think more reasoned discussions in the process about how to think about benefits and costs associated with programs.
Great, thanks, Pam. Josh?
Yeah, so I think it's across a number of programs, but I want to go back to that very unsexy work that I talked about at the beginning. So Niskanen talk a lot about secret Congress, where there's a bunch of nerds in different committees who really care about seeing well-run programs. So, we have Wyden and Crapo on UI program modernization. We might see some changes in TANF, might see some changes in the way we pay out Medicare to get more efficiencies out of a very expensive program. So I think there's a lot. They don't necessarily make it into the news, but they're happening behind the scenes. Folks really care about them, and there's a lot of bipartisan support for these various reforms.
Great, thanks, Josh. And Peggy?
Yeah, I think along those lines in the housing space as well, right? Some of the things to increase supply, whether it's the low-income housing tax credit or other ways to help build single-family housing. There are also some things that in the rental assistance space, in the housing choice voucher program, that we think should have bipartisan support around streamlining things like, Pam talked about these little things that are that are just repetitive or unnecessary, like like inspecting rental units every time someone new moves into it, or inspecting rental units that are less than 5 years old. Things like that could that we actually showed during the pandemic we didn't need, and that there were alternative ways and cheaper ways to do those same functions.
Okay. I just want to point out that someone in the chat said, bless the nerds. So Josh, you have a fan club.
All of us, all
All
us
of
are
you, all of
nerds.
you, self-identified. So I want to give you each a chance to give a very brief closing thought. What would each of you like folks to leave this conversation thinking about or remembering? And we'll do Pam, Angela, then Peggy and Josh.
There's a lot. I think we're all kind of feeling this right now, especially for those of us who spend a lot of time and energy and effort in terms of thinking about these social welfare programs, how critical they are to people's well-being, families, children, the disabled. I think that it's just really important for those of us who really care about these programs and really care about their effectiveness, their ability to meet their primary goals, improving health, improving nutrition, that we continue to do kind of the work around those issues to just remind people what these programs are about and remind them about how important they are. And just to close out with like Medicaid as an example, I mean, in practice now, Medicaid it wasn't always this way, but people really understand the importance of Medicaid now. They really understand it's popular in a way that it didn't used to be because people understand how important it is. And so I personally just sort of try to keep that in mind when I see spaces where we're looking at like proposals for really radical changes, and just really hoping that people can kind of keep in mind that we want to be sure that we maintain the primary goals of those programs and ensuring the health and well-being of vulnerable.
Great, thank you, Pam. And Angela?
Sure, I'll just kind of piggyback off what Pam was saying and I guess kind of leaving people with one thought, which is, there are very, very well-intentioned, reasonable, thoughtful people on both sides of this issue. There's people who care about people, low-income households who are Republicans, and there are Democrats as well in Congress. And I think response to proposals or things without fully thinking through issues and seeing both sides. And I just think that I benefit greatly from reading Pam's work, for example, and all the work that comes out of CBPP, and it makes me think about issues another way. And there's so much nuance to all of these questions that we've posed. There's not easy solutions. And so I think we just all need to keep talking to each other, reading each other, and keeping an open mind.
Thanks. Peggy?
Now, along those lines, I think what's really important is the solutions piece, right? These, the programs that we're talking about are not perfect. If they were, then we wouldn't, then we wouldn't be here. And so, while there is a component of defending aspects of the programs and trying to make sure we don't lose ground in the impact that we're having on people's lives, we also have to bring forward the solutions that would keep making the programs better. And as Angela said, keep talking to each other about what those solutions could be, because there is some experimentation in trying to find the best solutions.
And Josh?
Yeah, no, I'll piggyback on what folks said here about, nuance is everything, right? So these are deeply complicated policy matters. There's a whole lot of trade-offs. But I think, everyone on this panel, everyone in this room is in a position to really delve into these issues. So making sure we're not giving in to, either cheerleading or sort of reacting against broad policies and thinking about what is the good parts, what are the bad parts. I think Pamela mentioned, the baby in the bathwater is something I find myself saying a whole lot this year. is making sure we're not throwing out the baby with the bathwater. There's going to be some good parts. There's going to be some stuff we don't like, but we're in position to talk in those nuanced ways. And there's a lot of folks out there, pundits, politicians, want being nuanced. So I think the folks in this webinar right now are in that position to add that nuance, and that's a great responsibility, but that's a privilege that I think we should all take pretty seriously.
Well, and that is a great place to leave it because we are at time. Thank you so much to Angela Rachidi, Josh McCabe, Pam Hurd, and Peggy Bailey for sharing their time, their experience, and research with us today. Thanks also to IRP Director Sarah Halpern-Meakin for her help with conceptualizing and putting together this webinar, and to Natea Taylor and Dawn Duran for handling the tech. As we mentioned before, we'll be posting the recording of the webinar within a day or so, and you'll receive a link to that by email. Thank you again for joining us, and have a great rest of your day.